going to breathe life into that growing pain or that celebration or that passion that you have. And I want to ignite it through stories. In order to do that, I'm going to have some conversations, some real good conversations to connect a story to somebody else's reality to inspire them. I'm going to have an impact on so many different lives. I'm a big fan in learning by listening to others. So let's get ready for an adventure full of different emotions that's going to be expressed from me to you to my guest. Are you ready to be inspired? Because I know that I am. This is something that I'm not giving up on. I'm going to do this. God, my lips are dry. I can see people on say you have to have a lot of talent to be told. Not only is she a doctor, but she's my friend. And she's been in general practice for over 21 years. So she's going to be able to give us so much knowledge. We're going to have a great conversation. I'm so excited to have you today. So, Nadia, how did you start the whole process of even thinking about becoming a doctor?
Well, first of all, I want to say thank you, Letitia, for inviting me to the program. I think it's very inspiring to have a platform such as yours to speak to our people about being positive. As you stated, yes, I am a general practitioner. More specifically, I am a family physician. I have been in practice for 21 years. I have to say that the my interest in medicine really peaked when I was in high school. Although I was born in a family, raised with my family where we had no healthcare providers, no one that had been either a nurse or had worked in a hospital. I had an interest in science. I was a geek and proud to
There's
say
nothing
it.
wrong with that. There's nothing wrong with that.
I also participated in programs, in research programs with professors, in the summer programs that gave me an eye as to what it would be to be a physician. And one pivotal program was a program that took me from Schenectady, New York, all the way to England, Sweden, and Hungary, where I got to compare healthcare system, their healthcare system with that of the US. And that was definitely pivotal. And in the subsequent year, I applied to medical school. My my application to medical school during that time, and we're thinking about some 30 years ago, was a rather an eye-opening experience. Certainly, as a woman of color, we were not well represented, and still are not as well represented in the sciences, and certainly in as physicians. But nevertheless, I also to have to thank God for making the ways, making the connections for me. I attended SUNY Health Center in Syracuse, New York. So you could see I did my schooling in New York City, in upstate New York, where I earned my degree as a medical doctor. And subsequently, I entered residency program. At first, I thought that I would be a surgeon, and I did do about 3 years of surgical training. They were in New York City. Started first in a hospital in Manhattan. Then I moved to Queens. But I found that although I love surgery and I love the highs of going into the OR, but there was missing a relationship with patients. I am one for long-term relationships, and when I became dismayed with that part of surgery. and also to the rigors of it. I have to be candid. Family medicine became for me the way that I would serve best. So I switched from surgery to family medicine, and thus I completed my training in family medicine in Queens, and I've worked since then in Brooklyn. Uh, I've worked mainly in areas of uh, um, of need. I've worked in several areas in Brooklyn, such as East New York, such as Brownsville, and East Harlem. But currently, I'm in Rhode Island, another state, and where I am still crafting this my profession.
So I'm so glad that you brought up this topic around that family, that connection that you wanted to have
Mhm,
with individuals, because I have to
mhm,
really ask this question because I'm so happy that I have this opportunity to just be honest with you and ask you questions that probably goes on in a lot of people's minds when it has to do with like family practice.
mhm, mhm.
So how hard is it for you to really maintain great connections with so many patients that you have? Because I always feel like when I go into my doctor, I adore her, but I know that she has to move on to the next patient, and for me having that connection is so important because I want to feel that, you know, it's not that you're just checking the box about all of the things that I need to take care of, but really more so having more of a conversation about your health. Do you
Mhm.
feel that to be challenging?
First, I have to also to speak of what it is to be a family physician.
Okay.
To be a family physician is well, family medicine, the part of medicine that's like internal medicine, where you're taking care of chronic patients with chronic illnesses, whether it's hypertension, diabetes, or if you were a pediatrician, you're taking care of babies, of young adults, where you're managing, you're preparing them for their sports, you're preparing them to go to school, you are managing their asthma, diabetes. But we, as family physician, we take care of both children and adults. We can manage from sunrise to sunset of life. Now, when we are trained as family physician, we also train to really approach not just the individual, but the individual in the concept of his or her family. And we will serve families in a psychosocial model where we're not just interested in addressing blood pressure, but in addressing the causes, the social, the mental, physical, the genetics of a person. So if I were to see you in the office, Letitia, I would be speaking to you not just about, oh, you need to take your blood pressure medication, but I need to know what are the circumstances around you and in your family that would help you to manage your high blood pressure. What are the things that you are interested in? And I could have a visit to speak about high blood pressure, but we speak about high blood pressure, but we're also to speak about what are you doing outside. For me, how I connect with patients, I get to know what they're interested in. I get to know their families or their work, what's important, and I include that when I'm seeing them, even if it's to speak for 5, 10 minutes. And I do the same thing, not just for adults, for kids, showing an interest in their schooling, an interest in their extracurricular activities, so that their eyes are brightened. They say, "Oh, someone is interested of me, not just as a patient." That has an appointment at 11:30, but someone who, oh my gosh, she's going to ask me about what I do, what I like. So
I think that
that's
that
how.
matters. That matters so much though, because way too often a lot of people think when even when they go to the doctor, they don't even think that they can build that relationship with their doctor. I think what you just said right now should inspire so many people to recognize that when you have a family practitioner, a doctor, you should feel comfortable with that person. You should be able to ask any type of question and not feel like you're just a patient, but you are an actual person.
I bring this to you as a family physician, general medicine or internal medicine colleagues, and pediatricians, many of them are doing it. So we do have some limitations of times, of pressures, but I think it's important. One of the things that we stress is for people to have a medical home. What is a medical home? A medical home is the place where you go and have your care. You have your provider, whether that provider is a physician or a nurse practitioner. You have your nurses, you have their support staff. Should be investing in your well-being. So if you were to come to when you go to a medical home, or which is your physician's or your nurse practitioner's office, you should feel at ease. Your mental well-being is important, and also too you have a support system. They also can help to coordinate your care in the building and outside of the building. So I think as a family physician, we have been trained to do that, and it's most of us do practice it in that vein.
So, this is a great segue because I want to bring it to taking that practice, which you just mentioned, as far as the connection, and then connecting it now to our community. Look at pre-existing conditions and how do you address it with your patients and have those type of conversations. I mean, I definitely want to talk about COVID because you know that is hitting our community really, really hard. But before we touch that, I kind of wanted to dive a little bit deeper into pre-existing conditions in our community and how do you have those type of conversations, and do you feel that there is more that we can do to help one another?
Wow, yes.
I know that's a big question.
That's a
That's a big question.
loaded, that's a loaded question.
But
Yes.
remember, we're trying to inspire somebody out there, so I'm quite sure whatever you provide to me is going to be knowledgeable for people to learn.
Yes. Well, as people in general, we get older, and also living in societies where there are stressors. We have developed over time some chronic issues. They may have started, and those chronic issues carried on often in our genetics. Issues such as diabetes, hypertension, obesity, asthma, depression, anxiety, cancer. What are often their basis? Their basis uh, often comes from stressors that have gone unattended, or that have really affected our immune system and have made it difficult for our bodies to recover, to repair. So our communities as people of color, whether we are of African descent or the Caribbeans, we do unfortunately and I forgot, poverty.
I have to ask this question before you continue on. Do you think that there is a difference of it being existing, like internally in our body, that like if I have a child, automatically you're going to be someone who needs to focus on diabetes? Because I always felt like the media, the news is always saying that a lot of our issues is pre, like you're exposed to it, you're most likely, the chances are higher. But to me, in my mind, it's almost like if you break the generational trauma and you focus on creating, eating more, healthier habits, and understanding the stress factors. Because I don't want to believe that just because I'm African American, that automatically I'm just going to be exposed to, diabetes because my grandmother had it. But yet I don't eat the way she eats. I don't eat the things that she used to eat. So in my mind, is it because I'm African American, or is it because the generational trauma of us teaching our, the generation to not eat healthy, and to not, not eat healthy, but not paying it attention?
Just because I was born in a poor poor environment, fortunately, if the stress likelihood that these conditions would appear in my persons, in my generation. And words are powerful, as well as action. As It's important that we speak, not only we speak life over ourselves. If we know what we are predisposed to, but we work to change way we should be seeing a difference. So if I know that I'm predisposed to high blood pressure, but I go ahead and do not pay attention. I eat whatever I want to eat. I do not manage the salt. I do not exercise. I do not maintain a healthy diet. Then, unfortunately, I will be most likely to develop high blood pressure. And suddenly, if I have financial stressors, I can't pay my bill on time. I'm not working at the right job, or I'm working 24/7 with no rest. I am afraid that if I'm stopped in the street, there will be some repercussion if I'm stopped. Is not just one thing. Health
Yeah.
is encompassing of a whole lot.
Okay, so if I was to sit right next to a European person versus someone of African descent, and it's two females, it's not like inside of my body there's something different than inside of her body.
Our DNAs are what makes us who we are in terms of like unique individuals. So you have the DNAs of your mother and your father, and whatever they may have had in life get passed on to that. So yes, you can be sitting with a Caucasian female, same age, but different DNAs, different DNAs in terms of what the DNAs carry. But is it all about what our DNAs show? Because there are things that doesn't necessarily express themselves. For example, in my family, there is a history of hypertension and diabetes, but does it necessarily have to express itself in me if I do the right thing? Certainly, it does not. Would there be a time that perhaps that DNA expression is strongest and it will show up? It can still do. It can still do that. But when it does, now what do we do? How do we manage it? How do we make it so that we live our best self? That's what we can have control of.
I want to bring it back to um, even thinking about me growing up. I don't think that there was any type of limitations on how I ate. My mother just made sure that I had food in my belly, and it wasn't until I got much older, and so I started to recognize what goes in my body does impact who I am. Like it changes my life. So now when you see patients in our community, how much of the concern is the traumas of the repeats versus them also, being knowledgeable about, eating correctly? I feel like sometimes it's so hard for certain communities to even eat healthy when they don't have the same access to, other to healthier foods. So how do you deal with that when you have a patient that comes in? You want to tread lightly, because you did mention to me it's a combination of both, like a mental and health. It kind of is connected with one another. But how do you connect to these patients to really explain to them the 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 benefits of eating healthy, or understanding that, just because there's a Popeyes or a Burger King right up the block from you, you don't have to choose to eat that. You can go to your local supermarket and pick up some healthier foods. Like, let's just talk about that a little bit, because I feel like that's a good conversation for people to hear.
Well, yeah, because unfortunately, what we have for so many years not realized is that food is medicine, and also that what we put in our body is very important. There are many areas of where there is food desert. Not They do not have access to a healthy or healthier alternatives. When I'm speaking to patients about that, is to say it's definitely faster and easy for you to take your money fast food. right next door, because guess what? 5 minutes, here's that, here's your package. Whereas the alternative can be, if you don't have access to fresh fruit, but you may have access to frozen vegetables,
Mm-hmm.
you can use that. If it's canned goods that you have access to, if you can, right now we have access to perhaps canned goods that may have a low salt, you can use that. Or if you're using the canned good, make sure that you wash it, you get rid of that, the preserve fluid that it was saved in, and wash it so that you can use it. Important to do that. I'm from Haiti. We love to eat rice. Oftentimes, we love to eat some certain fried food. So, what recommend oftentimes? I said, instead of rice, instead of looking at doing the white rice, why don't we look at some of the alternatives that we also do have? If we're going to fried, we some of us do like a fried chicken or fried meat. Why don't we bake it? If we're going to use seasoning, instead of using the packaged seasoning that already has a lot of salt and other bad chemical, why don't we try to use fresh herbs, the garlics, the onions, the celeries, and yes, with little salt or some seasoning, but you can enhance it by using those natural spices that can flavor the food. And we can still cook vegetables that's either fresh or frozen, and still get good nutrients. So you start you I usually try to start slow, and also to do a replacement. I think of speaking people about replacing as opposed to taking away, because it's all about our languages too. So I do
So
that.
I'm just want to get some brownie points, even though you're not my doctor per se. I will say one thing that I've learned about the supermarkets: when you walk in the door, the first thing typically is the fruit and vegetable stand. I love to stay in that area a whole lot.
And
And
they're the
then
smallest as well.
usually the reason why the vegetable and the fruit stand is at the very beginning, because they know that the food goes bad first. So they want you, as soon as you start your shopping experience, to get through that, because they know that they waste a lot of food. And I found that to be interesting, because a lot of the supermarkets, one would think, they're trying to promote like healthy, but it's all a marketing thing if you really paid attention. So if
Mm-hmm.
you go into the supermarket, you go to the fruits and vegetables, and you stay out of the middle lanes. That's just my kind of thing.
Mm-hmm. Mm-hmm.
And then if you go on the outer side, it all depends on if you're a meat lover or not. I mean, I'm someone who just do like salmon and turkey. That's
Mm-hmm.
all I really do. And then I
Mm-hmm.
actually, there's no more for me to be in a supermarket, because everything else is just so unhealthy. I
Mm-hmm.
think that people would really understand that, just because even if your neighborhood doesn't have like a Trader Joe's or a Whole Food, you can go to a supermarket. You just got to know how to pick those right choices when you walk inside the supermarket. That's the key thing.
That's it. That's it. You've nailed it right there in terms of spending more time in the vegetables and fruits, and as well as even in that periphery. Usually in the periphery, they might have some alternatives in terms of some of the dairy or non-dairy products that if people use. But as well as, if you stay in the frozen section aisle, where they have the frozen vegetables, those are also better alternatives than even using the cans. When I first moved to this country, young in my teens, and my mother taking us to the supermarket, we will spend, unfortunately, a whole lot of time getting cereals, getting sodas, and come to find out that, they're not the best thing. But unfortunately, also, but that's what also they could afford. That's what their monies
No,
went
definitely.
further along doing that.
Yeah,
And but we now know better. We now can change,
definitely.
by breaking that cycle, by not staying in those aisles, knowing that there's nothing good in them. Not there should be very few things in your house that's boxed, because for them to be on the shelf, it they need a whole lot of preservatives. And
Yes,
if something can stay on your shelf for more than for more than a month,
it's
you
true.
know, you know,
Like, why do you
you
want
know
that in
it's
your
not
body?
good.
If you really think about it, if something can stay on the shelf for a month and longer, like, why would you want that to sit in your body?
Well,
For me, that's how I connect it to myself. So, like, if we're teaching our kids at a younger age what nutritional value means, because just like
mm-hmm,
for you too, like my mother just fed me as long as I ate, but there is a
that's it.
huge difference now because we got to teach them to read the back of the package, understand what it can
Mm-hmm,
do to your body. So, but now I
yes.
do have to ask that next question as far as like diabetes and high blood pressure. Those two,
Mm-hmm,
especially high blood pressure, because it's like a silent killer. You don't
mm-hmm,
feel it and it can
yes.
happen to you. you know what can we do? I mean, I think you touched on it already, but I really feel
Mm-hmm,
so sincere around those two because
mm-hmm,
it happens a lot in our community.
mm-hmm.
What knowledge can you share and what can we do to try to change the trajectory of having high blood pressure and diabetes run so strong in our community?
It's one of those it's not a mystery, it's not a mystery illness, but yet it's an illness that really is doing damages, because it it is important for us as people to be screened for high blood pressure. And when does that happen? We start screening for hypertension with children, right?
Mm,
Because then when you take your child to the doctor,
that is true.
if
You
they
get
are
the
3 years old,
uh-huh.
their blood pressures are taken.
Yeah.
Okay. And it should not be just be, oh, it's just taken. They are good values and bad values. Unfortunately, if they're not looked at from that time, you can go on in life thinking, oh, my blood pressure is good. No one says anything when it has been inching up and high. Now,
Yeah.
what do we know that cause high blood pressure? Most will just say we don't know. All we can tell you is that the pressures in the walls of your blood vessels, they are much higher than they should be, and that get transmitted to the blood. So the blood moves through your system faster than it moves through your heart vessels faster than it should. What are some of the underlying things? Stress,
Mm-hmm.
unresolved anger, right?
Isn't that crazy how anger can
We
actually change
forget
your
we
blood
forget about the
pressure?
emotional aspect of health,
Yeah.
because we're
Yeah.
thinking, oh, it's just salt. Yes, salt intake is there too, but then there are folks who are developing hypertension, and they've been good with their salt. But if you're stressed, if you're depressed, if you're anxious, and there could be many things that, don't even get me started about, oh, what can cause those, the stressors at work and all that. So if all of that is going on, family tension, unresolved trauma, they
Yeah.
give they can they our body takes that as insult, and it as it never recovers, as the anger, the frustration, they continue through life, and that we're talking about kids and up, it's energy that's going
Mm-hmm.
to transfer somewhere else.
I always say that your thoughts can actually make you sick. Like the
Oh
way you think
yes,
about life and the way you approach things can actually make you
yes,
sick.
yes,
And
yes.
I think a lot of people, and I'm so happy you're saying this right now because a lot of people connect the physical being to saying that's going to equal to health. But honestly, and this is just another thing that I do feel like this country could do so much better on mental health because mental health connects to so many different avenues. So imagine if we had, more conversations around like what you just mentioned to me, how your stress factors can really
Mhm,
impact how your physical being is. I
mhm,
think they don't
mhm.
talk about that enough. I think it's
I think it's because for the longest of time we thought of, there's the physical, there's the mental, they're separate, right? And don't realize that what goes on here or here impact the internal and the external, right? Because then it's
Definitely.
all energy that has to be moved somewhere till we get to a point where we really can bring the two together. And for the longest also too, when people think of mental health, they look say that you're crazy to think when someone said but depressed or anxious. So what do you have to be anxious about? What do you have to be depressed about? Whereas those elements, when they're not addressed, will impact. One of the things that we know, unfortunately, people with mental health, unfortunately, also to have a higher degree of chronic illness such as high blood pressure and diabetes.
Mm-hmm.
And and most of us, we do not have good mental well-being and spiritual well-being. So until and when one part of our lives is out of sync, the other part will be. So until we recognize that we are a whole being, then it's going to be difficult to really get those things under control. It's not just the United States that struggles with aligning mental health with physical health. Many countries, many societies, unfortunately do. So,
Well, I'm a fan of mental health. I am the first
mhm,
person that would raise their hand and let people know I've seen a mental health therapist, and it's an amazing thing because it helps you put
mhm,
the pieces to the puzzle. I think people need to
yes,
understand that there is a difference of a psychiatrist versus a mental health therapist. I mean, and don't
mhm,
get me wrong, there isn't anything wrong if you need to seek psychiatric help as well too. But for some,
mhm,
I feel like everybody can focus and talk out loud about exercising their body, but they don't talk about exercising their mind. I'm just a component of when you go to seek mental health therapy, it's like you're exercising your mind. That's exactly
yeah.
what you're doing. You're having conversations about feelings and thoughts, but it doesn't necessarily mean that you're crazy.
Yes, and also too, it doesn't mean that one has to wait until they have a diagnosis of depression or anxiety or any other of what we well know as mental health to really be in counseling, because often there might be some ways that we are doing things, we are eating or not eating, some ways that we are looking at a point of view that has been shaped by some event, some trauma that you're not even aware of. That being in counseling, and also counseling doesn't have to be that you're in it for a long period of time, but then to help you to find alignment in
Definitely.
what's best for you is important. I am a proponent of that.
Me too. Let me tell you something. I've known my therapist for 17 years now. I've known her for 17 years, and she has gotten me through a lot of different obstacles. It wasn't it has been years that I didn't see her like consecutively, but we
Yes.
stay in contact. And whenever certain feelings come to my mind, or it's like a new chapter in my life, I'm
Mhm.
transitioning, and it could just be about entrepreneurship. It doesn't necessarily have to be about a depressing
No,
and if it
it
is,
doesn't
I'm
have to be
okay
have
with
to be
talking
about a
to
bad.
her.
It doesn't have to be about a bad relationship or a
Yeah.
bad job. It just has to be. But also, too, I think one of the things, Letitia, is that I think for a lot of us who are certainly of this generation, and have also to been able to be blessed with the means of
Mm,
accessing that care, we find it necessary. But I would love for one day for it to be so that everyone who wants to can do that. I think that's a tall order, but it's not a difficult order. It's one that hopefully that will happen, because it's all about aligning ourselves. Massages also do are really good. It's important that that we do that. When we go on those vacations, that we're like, oh yeah. But then most masseurs will tell you it really helps to your blood flow going to stimulate your immune system. But what happened? Unfortunately, a lot of us cannot afford it,
afford
or
it.
we don't know about it. It's the realm, much like counseling, it's the realm of the well-to-do. They've kept that as part of work. That's what makes them elite. If we knew the goodness of it, back in my country, Whenever you're sick, they will like, get someone to, massage you. I remember to massaging my grandmother. It's good thing. If we could return to those times,
Yeah,
from
I
those
mean,
previous
because I was
time.
actually going to say right now, maybe there's ways to be creative. Like if you can't really afford to get a masseuse, maybe there's somebody, a family member that can kind of help you out.
Yeah,
I think
yeah.
it's a like what you said, to find ways, because I'm also someone who believes in meditation, who
Hmm.
believes in, yoga. And there's like you can go on YouTube right now and find, somebody that's teaching those type of practices and try to utilize it, because I agree with you. It's holistically, like we need to kind of think about health from that aspect. So I'm so happy you
Hmm.
were able to kind of say that, because maybe somebody out there will say to themselves, okay, I may not be able to go get an expensive massage or go to a supermarket that I can't afford, or, but you can be creative and think of
Yes.
ways to do it. You know, Now I kind of really want to touch bases on this whole COVID
Hmm.
and, in our communities, and especially connecting it to the pre-existing conditions. And because I've heard, like, when it all came about, it was just, at the beginning there was a lot of people would say things that were not true, that Black people don't get COVID, and then it just shifted, and then it turned into mostly Black and brown people are getting COVID, and it's because of the pre-existing condition. I guess the fluid that gets stuck in their lungs. I don't really know too much, and I said to myself, I really want to ask questions like this, because I'm quite sure I'm not the only person that's thinking this
Hmm.
way. So like here
Hmm.
you have COVID, where it seems like you get fluid in your lungs, but
Yes.
then it seems as though like Black and brown people are dying from it faster, and they say a lot because they got these pre-existing conditions. So how is it connected to one another?
Well, I think what happened is with COVID, COVID exposed wide open to us the disparities that exist among us. For so long, the health resources in our communities have been less than optimum. Chronic illnesses, so whether it's hypertension, diabetes, and if unfortunately those are uncontrolled, and you have a virus that thrives on decreasing further your immune system, and you add to it stressors, we unfortunately living in compacted settings, right?
Mhm.
It's a recipe for disaster. Now, when it first hit us, we were not prepared for it. We did not know too much about it. African and brown community, we're talking about a lot of our first line workers. Who are
Yeah,
they? They are our nurses. They are
yeah.
our CNAs or a medical assistant. They are cleaners, the health
Yeah.
maintenance workers. And they're working in hospitals, in supermarket. They were working with very little instruction
Protective
or
wear.
supplies
Yeah.
of protective gears. They are unfortunately also living in compacted communities, several generations living under one roof. And because
Yeah.
also we do believe in that. We do believe in a lot of us do believe in, like, keeping our family, the generations together. And so therefore there were people were leaving work, going home, circumstances, trying to keep themselves less infective by doing by following the precautions. But still, this virus was tricky, and we have family members, different generations that have been struggling with illnesses that perhaps were not controlled, and it caused havoc and is until unfortunately still causing havoc. So talking about the fluid that COVID elicits, yes, it is one of the ways that it attacks the lungs or even our um, gastrointestinal system is by producing a lot of mucus. So whether patients have a lot of mucus in their lungs or in their GI tract, and by that that's when they usually would have the more diarrheal symptoms, or is how it's present. Now, when COVID first got to us, we did not know how to really manage it. A lot of people were going on respirators in the traditional way, respirators lying flat, right? Whereas we now know that even if you're having respiratory symptoms, it's best to stay upright or prone so that you can get that, they can work to get that mucus out. Unfortunately, we did not know that at the beginning, at the starts of this pandemic. But now we're seeing, even though folks, there are folks that still need to be intubated, but we're seeing the death rate less because the measures are different. So it's not just, there's nothing, it's not just, to say that it's something genetically in us that makes us more prone to COVID. It's just, it's the environment
I'm glad you
that
said
it
this.
set itself in.
So, how, and I gotta ask, because you're a doctor, are you afraid, like when patients are coming in and you're not certain if they have COVID or not? Like, how do you manage that?
First and foremost, I do believe in God. If I'm doing this work, it's because God ordained me, and that's the reason why I'm in it. No way of knowing, even under protective equipment that we have, that those are the only things that protect. See any patient as a potential COVID, but then I still treat you as if I would even before COVID. We follow the cautionary measures that are in place, but you may have been exposed to it and be positive and not even know it. I'm not going to approach someone who's just coming in for high blood pressure versus someone who's coming in with a cough any differently. I've had I remember the first when COVID first started in my current line of work, we set up tents, we were testing folks, but it wasn't because I had my gloves on that I did not have it. Who knows? I may have had it and did not even realize it. I think most people may have had this virus even before it was declared present in this country.
How do you feel about vaccines?
Well, I feel vaccines are protective. I have been vaccinated. I speak for the vaccines. I know that there have been many things said regarding the vaccines. It came on too fast, or it's a way of controlling us, or it's going to change our DNA, or it's meant to hurt our community. But think about it. These are we do treat, not no, vaccines are not treatment, but we have been able to manage a lot of viral illnesses because of vaccines. COVID-19 is no different. Followed protocols before they could put them out to be used to the general public over a swath of people of different ages, different race, uh, and not just in this country, but in the world. So while I know that certainly our community, medicine has not been kind to us in many ways, the Tuskegee experiment that really had
Hmm.
caused a lot of harm in our community, efforts at fortunately sterilizing people with mental health. Medicine has not always had a good history in this country. For people to go and say that this vaccine is meant to hurt or to control, I think
Yeah.
I think for me, I think it's disruptive, it's dangerous to do. What's the job that it's supposed to do? Is to decrease hospitalization and even to decrease death. The more that people take it, the less the activity of the virus. Now, while I'm on it, people say, oh, it's not covering variants. Oh, we're going to have to take it third dose. I anticipate we may have to it may have to go the way of the flu vaccine every, at least periodically. Why? Because viruses change. The flu, think of the flu. Every year we have a new flu vaccine because you have different type of flu. So that's the same thing with this COVID-19. Every season that the coronavirus would have become active, because coronavirus has been around for millions of years. This is not something new. Every year a different strains come out. So that's what we're seeing.
So I will say that I'm totally open to getting the shot. But when Johnson and Johnson came out and that whole debacle, how they put it on pause, I'm wondering if that's stopping more people now to believe in the science. I'm personally want to get the two-dose shots versus the Johnson and Johnson, but I think that that's something probably to talk about as well too, because I feel people are now going to feel this, oh, I told you so type, you
What?
know?
Oh, absolutely. And but then let's talk about that. You have a report of about 6 individuals, 6 patients. 3 of them unfortunately passed, which is sad. But think of the number of millions that have taken the vaccines. 6 versus several million. Let's
Yeah.
do the math. And okay, what happened every year of the number of people, adults or kids, who died or have adverse reaction of other vaccines? But yet we're still using these vaccines, and yet these vaccines are still effective. I mean, we really need to really be careful uh, uh not to let this distract us from the real killer. The real killer is COVID. So headstrong to say, no, this is not for me. That's the real killer. Your resistance. The less of us that are vaccinated, the more active this virus will continue to be.
This is just a statement, not really a question. My personal opinion, I think, given the fact that the president that we had prior to, when this all came about, the way he kind of handled COVID, where it was almost like it's not a big deal. I think that didn't help as well too when they started to announce that they're going to have a vaccine. I do wonder, like, say if we had a different president at the time, handling it different, and then also the media not giving him that platform to constantly make the comments that he made, like it's not a big deal. Now here we are, fast forward, where we're trying to get the world, not even just our country, the world, to be at a better place. I think people need to expand the way that they're thinking and looking at it. That I like what you said, that it's more of, it's not about only getting the shot, but getting that thought out of your mind to say that if you get the shot, all of these things that are going to occur, which honestly there's nothing has been proven around it, but we make up this story and then we run with it, and here we are, where I don't know about anybody else, but don't you want to get back to some sense of normalcy? Like,
Well, that's the same thing. That's what I say. I mean, unfortunately, yes, COVID had been politicized in this country, and to our detriment. It led to an increased level of skepticism.
I want you to inspire somebody, as far as somebody thinking about becoming a doctor and there's some type of hesitation that they have. And then I also
Mhm.
want you to inspire someone who feels that, my general doctor, it's just something I got to do once a year. And whenever, I go, they'll check off the box and I'll leave. I want you to inspire that person to understand that connection that they should have with their doctor.
Whether you are a young woman, a young man, or someone who's had a previous career and been thinking, healthcare is where my heart is. I would say one of the things that you can do for yourself is start looking at ways of getting uh, experience to an experience, a working experience, not working to make money, but to be able to have a mentor, or be in a program where you can go in a setting where you could see who's in medicine and what they'll do, how they did it. How do you do that? You can do that by volunteering. You can volunteer not just in a hospital. You can try to volunteer in a clinic. You can volunteer in a nursing home. Volunteer or with any organization. Do a mission within this country or outside of the country where they're providing healthcare. So you could see the interactions that the nurses, the doctors, the nurse practitioners, the supporting staff they're having, and whether they're experiencing joy or satisfaction or the reverse, and to understand why they do it. And also, not to second guess yourself. If you know in your heart that, I'm called to become a nurse, or I'm called to become a physician, go for it. And how do you go for it? Learn about it. Ask your counselors. If the counselors do not have in school, high school, college, or if they don't have the answer, or if you feel that they are steering you the wrong way, to connect with a local doctor. Even ask your provider themselves, and they can steer you in the right direction. Because guess what? People, I think a lot of times, certainly people of color, we think, oh, only people who are top of their classes. Yes, there's nothing wrong to being top of your classes. Absolutely, I do want you to be top of your classes, but that doesn't mean just if you're not earning A's and but you're earning B's. Or if you even earning C's, but you know that this is what you call for, you don't go for it. If God has put in you that seed, you know that seed for greatness, strive for it. Try to find someone to connect with, local clinic, even your doctor, your nurse. Try to find out who they are so that they can pass on their tip. Read, ask question. Even if sometimes you may be asking question of someone who may not want to answer it. If they don't want to answer it, find it somewhere else. Don't let people's intimidate you or their opinion of you. You form your own opinion. When I was in college and I was applying for medical school, I had to go around and ask people, could they see me? That was an exercise. Could they see me as a doctor? And one of my friends, she's like, she could not see me as a doctor.
Wow.
Yet.
Look at you 21 years later. Yeah.
So form your own opinion about yourself and know who you are. No, I don't know if I may be speaking to someone, whether or not you know God. Know that God has a purpose for you, and if He has put in your heart that you would be a physician, that you will be a nurse, that you will be a nurse practitioner, that you will be someone in healthcare, or even in administration, know that He would make the way for you, because He says God has a project to prosper you and to give you a good future. But you have to work. You have to work hard. You have to know that, yes, you're going to read. You're going to read for the rest of your life. You have to know that you're going to be asking questions, and people will question you, but that's okay. If He gave you the desire to become a health practitioner, He will give you the sustenance. He will give you the strength to do it. Now, to someone who just go to a provider once a year, you don't have a connection. I like connection. When I go, like anybody else, when I go to see a provider, if I don't feel a connection, I'm not going back. Because guess what? I have to feel that someone has my best interest at heart, no matter who that person is, no matter what color he or she may be, because you have to get that sense. And if you don't have that sense, even if the person maybe, because not all of us are lovey-dovey, communicative, but then there should be something in that person to connect. Because something to connect, that that he or she has your best interest, whether it's a generalist or a specialist. But my specialist colleagues can be different depending on where on what strata they may be, because they may not have the time to give you. They just focus on what they need to do. Certainly, some surgeons, the neurosurgeons, they just want to make sure that they get that tumor out of you, and you go back. But for your general practitioner, someone that you would have to call when you need a medication, or when you need counseling, or your mom died, and you need to know somebody you need to speak to. You need to feel a connection, because if you don't have that connection, you're not going to feel that they have your best interest at heart. So seek it, and understand that every doctor's not every style is for everyone. find your style, because once you find your style, you'll be happy. You'll be happy with that person.
Well, I have to say that I know that you're not my doctor, but you have full of life and energy. So I can only imagine that your patients, they adore you and look forward to each visit. This was really
I
big because
hope. I hope.
I really do feel people don't understand what a general doctor, family practitioner can actually offer. I think a lot of
Mhm.
them just go for their yearly checkup, and then sometimes if they have, you know, a cough and they want to look into it. But I really think that
Mhm.
they should think about going to their doctor, asking the right questions, forming a relationship, and if that connection is not
Yeah.
with, you know, for you, then you find that right doctor.
Yeah.
Because a family practitioner, from my understanding, you even made it even clearer to me that you are looking at it holistically, like you're looking at
Mhm.
everything. And I think people
Mhm.
really need to understand that when they walk in the door, because if you don't think that this doctor is going to give you the whole entire story, then, you know, find another one.
Yes,
So
yes, and also too, it's all in the approach too. I mean, it's both ways, but then it's both ways. It's both, the provider as well as the patient. But yes, but I think find your fit. Not everyone, not every relationship fit.
this was a really really great conversation. I think that, you know, there was some takeaways for me as far as
Mhm.
how I even look at health in general. And I think for you to even come on my platform, I so appreciate it so much, because I really, the goal for me is just to, even if we change or impact one person that listens to this video, that means that, you know, I did something that I can help change the world into a better place. And Nadia was a part of this journey. So I appreciate it so much. I hope that you return and come back. Maybe we have another whole different topic.
I want to say I thank you. I thank you for that opportunity. But and I hope that I had inspired to break a cycle, to break a cycle of stress, to break a cycle of poor health, and also to be inspired to become a better you. If it's in you, it's in you, but then it has to be revealed, and it can be revealed by connection, by question, by seeking. It's been a pleasure speaking to you, and I'm looking forward to another invitation